Hello and welcome to Conversations here on NTA Network. My name is Nike, as you know, and we always talk about something really interesting, something engaging in the conversations room. We have a full house. I'm going to let everyone introduce themselves before we get to the topic of today.
Good evening. I'm Dr. Adeze Ore. I'm a consultant family physician with the Federal Ministry of Health.
Kevin Fineface, public good advocate and security and energy expert, based in Abuja, but travel everywhere.
Enobon Robin, just Enobon Robin.
Rekiva Salibello.
I am Andy Uka, work with Environmental Health Officers Registration Council, Nigeria.
All right. Like I said, it's a full house, and just before the camera started rolling, the topic took me by surprise. We're talking about Lassa fever, and you won't believe just how many Nigerians don't know what it's all about. Some people say it's a myth, some people say it's real, but it's not particular to me or my family or my own side of the country, which isn't true. So today we're taking it apart bit by bit. So we're talking about Lassa fever. We'll take a quick break, and we're going to ask some Nigerians on the streets what they know about Lassa fever, and we'll be right back.
It's been making the rounds on the news lately. It's an infection, okay, that you contact mainly through rodents, who are most of the time the carriers of the virus. So if the feces or the urine of the rodent contaminates a meal, or you come in direct contact with this rodent who are carriers of this virus, you get infected. Another means of getting this infection is by, interacting or being contaminated with someone who is infected with this virus.
Lassa fever is a hemorrhagic fever. It's a fever that is gotten from rats-related issues.
Yeah, the thing is what I know about Lassa fever. It's a disease that they used to about 1 or 2 years for now. Where the little things why I know for the Lassa fever is that it's a disease they used to contact through some certain things like rats.
Lassa fever is caused by a virus and from rats. You can get it from rats, and it can be transmitted from one person to another.
Actually, I don't know anything about it.
Not really, but I know that it's a deadly disease, it's a virus disease.
I know few something about Lassa fever. I know about Lassa fever. Lassa fever is the one kind disease, and it's not good for human being to expose food for rats to shit inside, and to see another person piss for one place and you go there, bend down and piss. Maybe the person has Lassa fever and you bend down piss, you must contact Lassa fever during, or to pause feed or something like that. So that's a little one I know. So I know about food, so it's not good for human being to expose food to.
I don't know, because I'm not a doctor. I don't know the cause of it. We just hear it. We have been hearing it since 2019. So as we are hearing it, let everybody be curious about it and know what to do.
When there's a child out there that's not getting the same that your own child is getting, the difference will tell, and there will come a time in the society where that child is going to take its pound of flesh.
Where you can actually, everything from watching a program with the child, you can start up the conversation from something on the TV and say, oh,
For me, it's like, hurry up with this business. And the other one said, Auntie, it's not about me, it's about the guys, they're not ready to marry.
Yes. See if she wants to ask something. No, I know my mother very well.
In fact, the most interesting one is when I put up pictures on WhatsApp, you know, Snapchat filters and all that, she will call me, remove that picture. There was a day I got tired of all that and I said,
There you have it. Some Nigerians just don't know exactly what Lassa fever is all about. We have two doctors in the house. I'm going to start with Dr. Andy. Maybe you tell us exactly what it is and how it affects all of us.
Actually, Lassa fever is a viral disease discovered in Nigeria in 1969 in a village called Lassa in Borno State. It is caused by rat as a carrier of the virus, and the rat always live in the bush. It's not something that live with man, but sometimes some necessities and some factors always bring them to the human dwelling. That is why it is always occurring during dry season, when the bushes are being burnt, the vegetation's gone, and they are not comfortable again. Lack of food, they try to migrate to human dwelling where they can look for shelter and for food. And if they contaminate the food of human being through their urine, their feces, their saliva, then they will drop the causative agent, which is virus, and in contact with man, maybe through the water or food or airborne, they will get infected and come down with Lassa fever disease.
Okay, and maybe you want to tell us about symptoms. How do I know?
Yeah, the symptoms are more like that of malaria. That is why sometimes it's very, very confusing. But as a later part of it starts to show like headache, maybe profound bleeding of blood from the nose and from other part of the body. Thereby, you can differentiate it now from malaria. Sometimes you treat it as malaria, it will not go. That's why, because it is just kind of that way, our medical doctors and nurses most of the time get in contact without knowing.
Okay, I know the rest of the team have more questions, but I have just one more. Are the vectors only rats? Is that the only way that we can get the fever?
Yeah, for now, rat is the main culprit.
Okay.
I think the studies are ongoing.
Okay.
We may come down with, or somebody may tell us, but basically now is that rat, and that rat is a specific rat, not all the rat.
Okay.
Mastomys natalensis, which the other time I came on the screen, I tried to let people tell us the name in their vernacular languages, because most of the time you discover that they do mistake it to straw rat, the one with long mouth, but this is bush rat. Like Igbo man can call it okohia or something like that. We have put that, let people tell us what they call it, so it will make us to know more about it.
Okay.
That's it.
Okay.
Recently, like a few days ago, I had a group of people that I was talking with it was in a shopping mall. So I had them, they were conversing and then arguing about Lassa fever. One was saying, if you touch somebody's hand, you're going to be contacted with Lassa fever. Or if some were saying, no, it has to be through contaminated food. Maybe when you go to the market, you buy vegetables, you get in contact with person that has Lassa fever. Some were even saying, when you inhale, like it's airborne, contaminated.
Airborne. Okay.
Yes. And I tried to tell them that no, it's not like that. It's not an airborne disease. There has to be a contact through blood, direct contact through blood.
Body secretions.
Yes, body secretions and all of that. And then I had recently, like as far back as 2 days ago, I had an advocacy that was saying that after 48 hours, if you treat malaria and the symptoms are still there, you should be queried for Lassa fever. And if it doesn't subside, because they have the same symptoms like you said, weakness of the body, joint pains, headaches, vomiting, and when it gets severe, it even affects the vital organs, right? The kidneys, the livers, and all of that. Yeah.
So basically, Lassa fever is a disease of hygiene and sanitation.
Okay.
So where people will be wondering, oh, if I touch someone, would I get the virus? You could. If the person you're touching is someone who doesn't practice regular hand washing and maybe has touched a domestic utensil, a plate, spoon, something that has been contaminated by rat feces or rat urine, somebody who may be infected, because up to 80% of people who are infected with the virus show no symptoms.
Yes.
Or very mild symptoms that they may just feel, look, I'm just tired. And so if you think about 80% of people who have the virus not even knowing that they are ill in the first place, and they don't practice good hygiene, then even from touching, one can contract it, because you touch the person, you touch your face, you touch your mouth, you know.
Your nose.
So so that's why we always try to emphasize the importance of
Hygiene.
personal and domestic hygiene, regular hand washing with water and soap, making sure that our living environments are clean, because it's when there's a lot of refuse around that the rats get attracted to that living environment and then start trying to come into the house. Another thing is the way we air and dry our food. People lay food outside where rats can easily gain access, drop their feces, drop their urine, and then after some hours you carry the food back inside. That's a source of the infection. Food that's not stored, like grains, gari, rice and all that, in covered containers or sealed sacks, rats can gain access and contaminate the food that way. So there's a lot for us to do in terms of personal and domestic hygiene, cleanliness and sanitation.
So needless to say, eating the rat itself is bad.
So
people eat rats.
People eat rats, and
But
that's
he said a specific, a particular type of rat.
Rats, yes.
Rats.
And there's also a specific type of rat that carries the virus.
Well, how would you know?
So that's the thing. If one were to encounter the rat, so now the type of rat is prevalent in our environment.
Okay. Yes.
It's in our domestic, especially in the suburbs and in the rural areas, in the bushes and the shrubs. So if you see the picture of the rat, it's the rat that we all see. But then one unique feature that the rat has is that on the belly, it has 2 lines of mammary
So
glands.
if you see a rat, you have to turn it over and look to check. So all rats are suspects. All rats are suspects.
If you're a rat, you're a suspect.
So that's why
You
you
turn
know,
your
okay,
belly to check.
Exactly. You're not going to stand there and be like, hey, rats.
By touching it, I might contaminate if it's
Exactly.
a
So what you need to do
rat.
is make sure that your house is not attractive to the rats in the first place, whatever type of rat it
Back
is.
to hygiene.
I have
Back to
some
hygiene.
pictures here,
Okay.
but I don't know if we have the opportunity of seeing it. Like what she's saying, I have some clips here. If we can,
We don't
but
mind.
I don't know.
Yeah.
I don't know. Doc, can I?
Sure. Yes, we don't mind.
Yeah.
Because I really can't turn a rat to see the belly.
I'm sorry, I can't.
So all rats are
Like
suspects.
she has said something on this.
Okay.
Sorry.
Careful.
About the
Careful with the
reason.
glass.
Let me see if this is how they behave. This is a litter of it. It's very, very prolific.
Maybe you want to hold one up.
This is
At
exhausting, guy.
This is the adult.
They are white in color?
Not
No,
white, but
it's
brown.
the light, it's the camera lights
the
that's
camera
making it.
light.
So they're brown to grey. So if you see, this is
Let's show the camera.
But these are just regular rats, though. These
exactly.
Yeah.
So these are the
It's
rats, the domestic rats you see
This one
around.
looks like the one the Chinese normally eat raw.
Corona. Let's not go there. Let's not go there.
You be
That's
quiet
another
and
topic on its
processing
own.
everything.
I feel very
And I believe
Can I
Doc,
see?
Yeah.
Yeah, this one
Doc,
just
I believe that it can also be contacted. This can be also contacted by airborne, because all those particles, the urine, the feces particles, enters into the air suspect. I believe.
So the thing is, if you have an infected individual who's sneezing
Yes.
profusely and the secretion that's coming out then gets on somebody else, it is possible to contract it that way. But just generally in the air, the virus doesn't survive just in the air. At least so far from the research that as at today. Far.
But the question I have now is from what you said, sir. You said Lassa fever has been in Nigeria since 1964?
1969.
Okay. Last week, I think January 27th, thereabout, I was watching Minister of State for Health, his interview on Lassa fever on Channels TV. And he said they are still trying to create laboratories to test for Lassa fever. They have not done, as at that date, 27th January 2020, they don't have
from Ministry of Health. So
yes,
she would give a better answer.
So, what he would have been referring to, there are reference laboratories that test for Lassa fever. There are several of them across the country. It's not in every state, but there are several. There are several reference laboratories that test for Lassa fever. So, because they are not in every single state, what the National Center for Disease Control does is has communications with state emergency operations centers, so that when a health facility
has a case,
reports a case, then they know the clear channels through which samples can be collected and taken to the nearest reference laboratory.
But what you just said now, samples collection, he said that the samples are sent to South Africa or is it Netherlands? I mean, I watched this man live, so
the information I'm giving you is the information that has just been released by the National Center for Disease Control.
Because this is not the first time we're having an epidemic of Lassa fever, so definitely there are laboratories.
As at last year, this time last year, the National Center for Disease Control also hosted a conference on Lassa fever and has started research on Lassa fever within the country. So it's not possible that all the samples are going to South Africa.
So that means this man.
There are not several test centers, as we have expected it for it to be. If Lassa has been like that, a point that has been around since 1960
for a very long time,
we should have been able to have laboratories,
several in each state,
up to 27 states, especially those states that are prone to. Now, but if you look at what
do we have states that are prone to?
Yes. Edo State.
We have it now in Lagos.
Even the northern states do have now.
Yes.
With what we've said, the epidemic is currently, rapidly based on human-to-human transmission.
Yes.
Now, if that's the case, it means that
it's not rats anymore. Sensitization.
It's no longer the rat issue now.
It's the human.
It's the human trafficking that is taking place.
The rat has passed it on.
That's where education comes in. That's where health officials also need to be able to be well educated in order to manage cases. Now, the challenge sometimes when you go to these hospitals, some of these health officials handle issues with a lot of laxity. You see a patient coming, you do wrong diagnosis. You're not even careful of your own health, knowing that there's this epidemic going on. Oh, you have headache. Okay, don't worry, give her paracetamol. I just know. You need to go through the procedure. So health officials need to be well educated, professionally trained to know how to manage cases. So every case that comes in is presumed to be one of those viral cases, so that people understand, they'll be able to. It's appalling to hear doctors will die because of Lassa fever.
No, but I think there's a bit of sensitization in most of the hospitals across the states. Yes, because of the prevalence now.
Not be so.
We would have been prepared before it comes. Yes,
because of Lassa fever.
Because of Lassa doctors.
Because we know that.
You mentioned specific channels. If there's a suspected case, if there's some channels, could you run us through what is supposed to happen in an ideal situation?
So in an ideal situation, say a patient comes into a primary healthcare center. That center, all the health workers who are interfacing with patients should know that if a patient comes in with these symptoms, and I'm suspecting...
Red flags.
Yes, I'm suspecting that this is a possible case of Lassa fever. In that primary healthcare center, you have an officer who has been assigned that you are the notification officer. So you are the one that will collect the information on that patient and send it to the next level within the local government, who will send it to the next communicate to the next level, which is the state, so that there is a clear channel of communication from the health post, primary healthcare center to the state, then to the federal, which is the NCDC.
So when the person died in the process, number of days.
So this is
that Kevin.
No, but then we're now in a technological age. So the way this information can be communicated is definitely not the way it would have been communicated in, say, 1970 after Lassa fever was
but you
discovered.
have the blood samples that are going to be taken.
No, the whole point of communicating is that you now have somebody who is designated, because that's a biohazardous material. It's not something that any random person should be collecting, because you're now exposing so many people to that potential virus, and also everybody that could have come in contact with that person. So when health workers are clearly told this is who is responsible and this is who they should be reporting to, then you now have a situation where the sample is collected and immediately sent to the nearest reference laboratory where it can be tested. Because it's not just the normal tests that we do for malaria, the rapid test. It's a highly technical test. And it's not you can't imagine a primary healthcare center.
But what's the number one red flag that you see that you suspect Lassa fever being a healthcare provider?
Because it's a viral infection that, like Dr. Andy said, presents similar to malaria, typhoid fever. You will have somebody who has had fever, treated for malaria, and is still presenting with active symptoms, fever. So it's those same things.
But aside Lassa fever, there are times you take anti-malaria and it doesn't work.
Yes.
You have to do a combination therapy to treat yourself.
But then
misdiagnosed. Sometimes misdiagnosis can kill someone before the main illness.
Yes, but the thing is that we're in a Lassa fever endemic environment.
Yes.
So we do not have the luxury of start. So everybody who is presenting with similar symptoms has been treated.
Everybody suspected
who is presenting with, because that's the case definition of a suspected case, is you have those symptoms, you've been treated for first malaria, the common things occur commonly, and it's not the symptoms are not abating. That's a suspected case, and you should start managing. So we have
you start managing.
No, you start managing the process is what I'm saying.
Okay.
So you suspect the case, and then you start testing the process of testing.
I think this is a seasonal disease now.
Yes.
Right from the time, if you check this chart now, you discover that this thing started 51 years ago.
Yes.
And from 1969 to 2011, by this calculation, the average is 3.5 states per year.
Yes.
From 1969 to 2011. But from 2012 to 2019, it has rise up to 20.1 states per year.
Yes.
Now, I think that since it is a seasonal disease, we should know that from October, we should be suspecting Lassa fever outbreak, because it is yearly. Now, I believe that there will be preparedness and response.
Okay.
That is, unlike what she said, the first contact is that once you test somebody, the temperature, malaria temperature will not exceed 37, 38 or point something. But viral, it will go like 38, 39. That will be the first indicator that this is not ordinary disease, but it is.
So we're saying the same thing.
Yeah.
The illnesses present similarly.
Yes.
So, like she was saying, those red flags is you have somebody who is in an endemic environment. Right. Even though it's seasonal, you know that there were still cases reported by NCDC as at December, as at November, as at October last year.
It's from December to June.
There were cases. There were even cases in August, in July, in June.
Yes.
So we won't say because it's seasonal and it increases during the Harmattan period, we should be lax, because those are the things that build up awareness of health workers. So when they're seeing patients regularly, it's also at the back of their minds that we live in an endemic environment.
Is there like a vaccine or something that someone can take?
Not yet.
There's no vaccine.
Not yet. After 51 years?
That's where I want to come in. There's this leadership failure.
It can never be eradicated.
No.
But I mean, a vaccine.
There are studies.
We cannot kill all the bush rats in the world.
No, we cannot. Even for animal protection.
Why is it that all the bush rats have
he mentioned the specific types.
No, I mean, those specific types. What if we have 100? Is it all of them that
it is only the infected ones.
It's only that species that has the capacity
to carry
the virus.
Okay.
The virus comes from nowhere, right? The virus comes from nowhere.
It's a punishment
the rat
demand
the
from
virus and goes to. Now, there's an aspect of hygiene on the aspect of human beings to be able to have personal hygiene, but there's also a systemic leadership failure. Since 1969, you have an outbreak. Steps are not being taken to ensure that we are fully prepared, seeing that this is seasonal occurrence from every October to June
dry
period,
season,
you
basically.
have this thing that we have human beings are traveling every now and then, because it was unlike before when the roads were very far for people to travel. Now we travel just anyhow. The planes are there to travel.
Yes.
And you mean there are no steps put in place to have some shots, even in mosquito and malaria. Today we have mosquitoes being developed in the lab that fights the female mosquitoes that carries malaria. We have that already ongoing in advanced societies, and we're not going to leapfrog.
Mosquito repellents, we have mosquito this, mosquito that, mosquito nets.
In as much as we want for those of us to take care of our environment. See, my place don't accommodate rats for 3 reasons. I have dogs.
Does that?
Yeah, my dogs. They don't see anything.
Dogs and cats.
But what if the dog
cats,
eats
I didn't know about that.
Will he contact the virus?
The dog does not have the capacity to transmit the virus.
2,
Oh, wow. Okay.
cleanliness is key. The rats operate. We all live in an ecosystem. If you have your debris, your refuse all scattered around, you will invite the rats to come in. Now, once the rat comes in, snake also comes in, because snake are designed to eat rats. The rat, to reduce the population of the rats. That's part of what it's designed.
That's the
Then if that happens, you also have other, insect and animals that comes within that environment to grow. So we also need to educate the people to say, look, do this first. Why government need to work? As you just need to ensure that we have the right laboratories. Closely related laboratories. Not that you take a sample from, you have to go to Uromi or somewhere. Urwa to go and do samples.
3 different tiers of government to get.
I'm curious.
It is when it comes to confirmatory.
We don't even need that.
We don't need that. Honestly speaking, the government has not done enough.
Hygiene, if you do your own job,
has not done enough
to do your own personal hygiene and your domestic hygiene and your neighborhood.
We have lost about 40-something.
Then
it's also
you're
a
also at
challenge.
risk.
And it's counting.
Yes, you're
We
also
have
at
lost
risk.
for some money and more counting. 200 and something people affected already.
Yes.
And it's counting. And you're telling me that we cannot prepare ourselves to get this thing stopped?
If I walk in to a hospital and it seems like I have Lassa fever, at which point do I get that confirmation? Is it 3 days after, 4 days
And
after?
do I get quarantine?
Yes.
It is.
No, you. Okay, no, you.
No, but how long will the doctor sit me down and say, okay, this is what's... how long does it take to find out?
Because once a patient is a suspected case, then the whole quarantine and isolation process should start from then. Even before.
But we're talking about 48 hours after treating malaria.
No,
right?
No, this is you're not. So the person comes in. So the incubation period of the Lassa fever is about 2 to 21 days, right?
Okay.
So first of all, the person has come in with symptoms. Then other questions are asked that also heighten the suspicion of, could this be a possible case of Lassa fever?
Yes.
And so based on that, you would then be suspecting that person. That means the person has to go into isolation thereafter, from the minute you suspect the person.
Do government hospitals have quarantine rooms?
So you
they do.
Most hospitals, and so that's one of the things that the NCDC is trying to do, is trying to encourage states, because we're in a federation.
Yeah.
So you implement things in Abuja, they may not necessarily be implemented at the state level.
Yes.
So what they're trying to do is work with states to ensure that the capacity at the state level, because these things are happening at the community and at the state level.
More.
That's where it's not necessarily in Wuse to Abuja, but it's at the community, at the state level, in suburbs, in the rural areas. So what are states then doing to make sure that the capacity of their health facilities at the community level, at the state level, to address this, make sure that there's active finding of cases of Lassa fever, make sure that there are steps in place to treat those who are suspected or confirmed cases of Lassa fever, and then what is being done to prevent further cases in the communities. But it's not just a policy thing from Abuja. It has to be implemented also at the state level.
There's no money to be shared.
So with Lassa fever treatment.
There's no money to be, no, because see, federal government also waits for donors. That's a sad thing.
Do you really think so?
Yes, no, they wait for donors. Because once the case gets into this prevalent state where the epidemic is rising, it calls for some form of sympathy. Donors begin to raise funds to ensure that this thing doesn't spread. Because you also have people who come in from outside. They have their people. They have all foreigners within the environment. They know that if they don't stem it, it will surely go out. Just like we have the coronavirus thing running. Yes. So countries are already moving to ensure that they doesn't
bring it in.
So you have to. So they are waiting for, even the states are waiting for federal government to release some form of funds.
Federal government are waiting for donors.
Donors, the state governments are also waiting for the federal government donation to come in to help them to set up these things. We have a problem in this country. Part of the problem we have in this country is that we haven't had people who are truly prepared for those offices they occupy, to occupy those offices. They get in there and what they're looking for is how to secure their children's future.
Secure the bag.
Future. So they look for ways to make more money.
Sometimes it takes more than one person to achieve.
You know, it takes more money.
Yes, exactly.
You would have the mind to do the job.
It will blow your mind, Rebecca. It will blow your mind to go to the budget to discover that every year funds are already been budgeted for this Lassa fever thing and not implemented.
Exactly.
Is Lassa fever, Dr. Andy, is Lassa fever a Nigerian problem? Do we have this in Cameroon?
No, it's
West Africa.
West Africa.
It's West Africa.
There are other countries, but I think it is more in Nigeria because of our population.
Nigeria has the highest number of cases. Nigeria has the oldest history of cases.
It was discovered.
So it's the same Lassa fever because once that nomenclature has been assigned, then that virus is Lassa fever. Countries like Ghana and some other West African countries, as recently as 2011, 2014, that they started having cases in some of those countries.
Actually, what I want to point out here is that the type of awareness we are having this year, we have not had it before. And something like this, it is when people know what is the problem, then the attitude will change and their practice will change. Sometimes if you are telling them, do this, they don't understand. But I believe that the awareness this year, if we can continue, like what Dr. Adeze said, I believe now that this Lassa fever has jumped the zoonotic state, like animal to man. I think human being now has become index of it. That means that is the bad part of it. That if it is now man to man, do you understand? So it will occur at any time. We won't wait that let it be from dry season now. So we need to kind of scale up our awareness campaign. That is why this year we know, even this January, like my organization has covered a lot of states. And we keep on going. Even in Abuja here, we have gone to markets, what we call market sanitation, because market is always the headquarters of rats, because they have places to hide, they have enough food and other things. And again, we are telling our people that since they have come to this, like what you people have said, there are two stages. Alive, as God created it, is not maintained by all these complicated processes. It's just simple. One is the environment must be clean. That's what we call environmental sanitation and personal hygiene. When we can continue, the first one is that the environment is clean. You tidy, your waste is okay, and other things. There's water to practice your sanitation. Then personal hygiene, like what I said now, look at the food. Anybody that comes, jump at it, isn't it? Now, do you know the condition of my hand?
No wonder I saw you didn't take anything here.
Yeah, even if the egg, I can't touch it now.
So all those things. So we try.
That picture you saw.
Then after that we try. Even there is a picture here. Then now that we know that even not only Lassa fever, the coronavirus is coming and it's airborne.
It cannot come to Nigeria.
We are hearing it. Then all this mouth and nose guy, it's simple. It's not a fashion, but like you can wear it. Going to market, buying all you are going to, it just maybe 15 naira. When you come, you dispose it and pick another one. All these little processes.
Would you go to the market wearing a guard?
You can.
I'm asking you, Noble. Would you go?
I'm not even going to market. I order it online.
The challenge we have in this country, which is the fact that people are not well educated as to know what to do. Nigerians will always want to do right.
Okay.
They're not well educated. 2, when you see those who are leading not doing what they're supposed to do, you want to do your own thing. 3, the resources are not readily available for people to spend. So they look for any means necessary for survival. Okay. You talked about sanitation. Do we have pipe-borne water flowing?
Exactly, that's where I was going to.
For people to be able to have that personal, you go to government, even this neighborhood here, the toilets are not flowing.
The sewage is in front of people's houses.
So refuse collection.
Refuse collection is a home for rats.
Failed system.
Which because if they don't go to the houses to eat, they can actually feed from that environment.
I can take care of my own personal hygiene.
You know?
But your neighbor, your neighbor, you're not sure of it. And
you're
then
not sure.
The environment, the government is not taking care of it. You can see.
So the government need to do that. That's why I said we have systemic failure of leadership.
Remember, we were on a program. Dr. Andy and I were on a program recently talking about the same Lassa fever issue. And the reason why we have to emphasize the fact that while we're trying to communicate to the public on the things that the public should do to protect themselves, protect their household, is multi-sectoral. So it's not just a health issue, it's not just an education issue, there's an environmental issue, there's an agricultural issue. So everybody has to do their bit because it's one thing to educate the public, you need to keep your house clean, you need to pack away your refuse, but what if they pack away the refuse and it's not collected by then the agency that
the government has to do more.
So everybody, all hands have to be on deck. This is not a time to apportion blame, but we do have to speak out on the need for everybody to do their bit. We're seeing that it's human to human, so there is a lot of room for prevention. And another thing is that even though we're hearing so much about Lassa fever now, we're having more cases seemingly than 2019, 2018. We're having less deaths and we're having less health workers affected because there's awareness and there are people who are working hard to try and do their bit, but there's still so much more to be done. So in a health facility, you teach the health workers on identifying cases, suspecting cases, but there are also other infection prevention and control things that they need to do. Gowns, masks, gloves, are all those things available in all the facilities as they should be? So those are also some of the challenges. And when people ask why is it that health workers who should know better are coming down with the virus,
you talked about
this is the reason.
If you have a suspected case of Lassa fever and you put the person in a quarantine, what proves that the person is free of Lassa fever and you let him interact with the society? When do you know that the person is free?
So there's a cutoff period because that's why I was talking about the incubation period.
Yes, 2 to 21 days.
Yes, if after that 21 days, that individual that is in isolation in quarantine has not developed any symptoms or anything.
What if he has?
So
the
person
will manifest.
The person will start coming down with signs and symptoms, and treatment should start.
Is there supportive treatment? At what point after treatment do you say that this person has been treated of Lassa fever?
No symptoms anymore.
But that's just
so. Is there stigma? Is there
you have to run a test
stigma
again
for those
to confirm that?
So the thing is that why all this awareness about presenting early, immediately you feel like you have a symptom, is that the chances of survival are increased with early treatment.
Intervention.
And the treatment is basically supportive, a lot of rehydration, drips and all that, and then the antiviral that works best if it's given early.
Is there stigma on those who have been released from quarantine?
Just like those who have AIDS.
Yes, I mean, because
definitely.
I mean,
you won't know. You won't know.
No, but what if
there should be a research? There should be a research. Because I don't want to ever talk to you.
You will
naturally want to stay away.
Won't tell you anyway.
But what if I know?
Yes, but if somebody knows,
tell you, no.
That's one of the things that we need to do in terms of educating people, so that you know that because this person has come out of quarantine, you're not at risk of contracting the virus. So definitely with every viral infection, there is some element of stigma, unfortunately.
Can I have, let's say I'm infected with the virus today and I get treated. Next year, is there a possibility for me? Or do I take a vaccine?
Again?
Okay,
there's no vaccine available.
Being resistant to it.
Yes, no, there's nothing like that.
I think one of that we should also emphasize is lifestyle. If we'll be able to improve our immune system, we'll be able to fight some of these things. So to some degree, I know that with the kind of food we eat these days, the fact that we eat food just anyhow, we hardly feed our body cells. We only feed our stomach and we're full. And so, but when we feed our body cells, I've been doing a lot of study because I wanted to stay longer. My daughter said I'm going to live for 120 years.
Okay.
So I want to be stronger at 100 and still do my stuff. But I now realize that, okay, eating according to your blood type and some kind of lifestyle will help to build your immune system to avoid some of these things. So if we talk about cleanliness, hygiene, your lifestyle, your eating habit, we need to be sure what you're eating, when you're eating, what you're eating, and why you should eat what you eat.
So that there's a greater chance you're the 80% who will not come
So
down.
would you advise us to kill all the rats if you see any rats?
No, that would be for ecosystem.
No,
you don't kill the rats.
You need that ecosystem. You need the rats in your ecosystem.
You do. As much as you need that ecosystem, but you don't allow, you can't live with rats because there are other diseases that rat can cause.
No, don't get me wrong. What I meant by this
if you see it,
if you completely annihilate
it's
rats,
not possible.
If you completely do that, you also cause
so you
that danger
agree
to
with me
yourself.
that if you see the rat,
what he's saying is that
within
the primary target of any prevention campaign should not be
eradication.
That shouldn't be the focus of prevention. While you're protecting your house by having dogs or cats, which will not allow the rats to survive.
When there's a child out there that's not getting the same that your own child is getting, the difference will tell, and there will come a time in the society where that child is going to take his pound of flesh.
Where you can actually, everything from watching a program with the child, you can start up the conversation from something on the TV and say, oh,
For me, it's like, hurry up with this business. And the other one said, Auntie, it's not about me, it's about the guys. They're not ready to marry.
See if she wants to ask something. No, I know my mother very well. In fact, the most interesting one is when I put up pictures on WhatsApp, Snapchat filters and all that, she will call me, remove that picture. There was a day I got tired of all that and I said,
When there's a child out there that's not getting the same that your own child is getting, The difference will tell, and there will come a time in the society where that child is going to take its pound of flesh.
Where you can actually, everything from watching a program with the child, you can start up the conversation from something on the TV and say, oh, you know.
For me, it's like, hurry up with this business. And the other one said, Auntie, it's not about me, it's about the guys. They're not ready to marry.
Yes. If she wants to ask something, no, I know my mother very well. In fact, the most interesting one is when I put up pictures on WhatsApp, you know, Snapchat filters and all that, she will call me, remove that picture. There was a day I got tired of all that and I said,
Dr. Andy, in the unfortunate case of someone dying from Lassa fever, what is the right protocol, right procedure of taking care of that? Yeah, burying
ordinarily, once somebody dies, it is a waste. Ordinarily, and you know that something led to that, and we need to know how to do that. Some people will be romancing the why. You may get other things apart from Lassa fever, but what we are saying is that from the preparation, once somebody dies, and or it is well known that the person dies out of Lassa fever, you don't need to go there.
Is the virus still active?
Yes, you don't need to go there. From preparation of that corpse to transportation, to burial, to everything.
And then disposal of the beddings, the clothing of the individual. All those things have to go with
yes.
So when you mean
education
when you say
now, education matters a lot with this thing.
Exactly,
because those are the more.
Yes.
You need to understand this.
Right.
That we have to be proper reporting. That this corpse they were bringing in died of this.
Yes.
You know, so that they get to know and prepare
in fact,
for
you
it.
don't need to release that to the owner of that corpse.
What do you do with it?
No, you keep it for a process. You know, we are talking about hygienic process. You don't release it.
Because a case of Lassa fever is a notifiable disease.
Yes.
So it's not something that, my relative died of Lassa fever. No.
But you know some religions, like my religion, would say bury the person as soon as he dies.
Yes.
We don't usually allow the body to stay for a particular period of time. So how would you convince me?
So that is the importance of strong primary healthcare systems.
Right.
Okay.
If you have a strong primary healthcare system, this is a system that is at the village level, is at the community level. So they have health workers who should go and supervise the burial process.
So it will be allowed.
Yes, so that it will be allowed according to religion, following strict protocol to safeguard the lives of those who are alive.
Do we do that?
In places where there are functional primary healthcare systems.
Why don't we have functional primary health care
everywhere?
This is part of
you're the government.
It is partly a state problem. It is partly a state problem.
The primary healthcare centers are in states, they're in local government. So each state has their priorities.
Okay, let's say we have a case and we report to the federal center or whatever here in Abuja. You can't make arrangements for somebody to go there and then observe the burial. Make sure that everything is
But if, like you said, within 24 hours, when would the person from Abuja get to that village?
The village, yes.
In maybe Andon in River State.
And that means we have to
do you understand?
bridge
So
that
those are some of the issues, which is why
but in the case that the person doesn't need to be buried in 24 hours, would you be able to do that?
Yes, if it's
but we are being contacted.
But the point is that is not how a sustainable system should be run. You should have capacity at the state level.
Why don't we have?
Even local government.
So the emphasis now is building capacity at the state level.
Next year we don't even pray for Lassa fever,
which is what NCDC is doing, is building capacity at the state levels, working with the states, because this is a state. They are an entity. You won't come and command and control. They have systems in place. So it's to build up the systems at the state level so that they can manage their healthcare systems at that level and safeguard the lives of their people.
Do you go to schools, like children's schools, to talk about sensitization, personal hygiene, Lassa fever, how it's contaminated? Because these children interact with different children from different perspectives of life.
No.
If you need a response, how much have you reached out to children in schools?
Yeah, we have school sanitation.
Okay.
Then what's happening is that these days, like this guy said, he said political interruption instead of political intervention. Sometimes now, and the professional dichotomy and rivalry, when you sometimes we will go, but now the educational board or something like that will say leave it for us, as if there is a this. But we from the local government, the sanitation is domiciled at the local government. But the problem is that the local government will be saying that they don't have enough money, but release it they will not. But what we need is to, one, employ those health personnel that can manage it. But when you go there, they don't have that financial capacity to do that. That's what we are thinking.
Because
yes,
sometimes, not to cut you short, you make budgetary provisions that are above some proven capacity.
Okay.
Now you want to go on campaigns. Instead of doing a campaign that will cost like maybe 100,000, it will be inflated to 500,000. And the man that's supposed to approve said there's no money for it. Okay, you wait. So he gives you 50,000 and you sort yourself out. At the end of the day, nothing is done. We know this works in the system. See, you know that. So we have to change.
Yeah. What
we have to change.
When we are saying there is freedom of
political
information now.
Yeah.
You can come to our own organization. We will tell you what we are doing. Then you can help us to even advertise us more on how to get.
In those days, you guys used to move around.
Yes.
But these days, you don't do that anymore.
That's true. That's the problem. One is shortage of manpower.
And two, funds.
So it's
Okay, we're out of time on Lassa, but you did raise a valid point.
Yes.
I remember back in the days when they used to go house to house to sensitize and inform people on cases such as this, like Lassa fever. We're out of time, unfortunately. It's been a very engaging episode of Conversations. Thanks to Dr. Adeze, Kevin Fineface, Enobong, Rakiba, and Dr. Andy for coming in and lending their voice to the program. I hope you learned a thing or two. I did. Our social media handles are also available on the screen. We would love to hear from you. See you again on another episode of Conversations. Goodbye.